Come in?
Hello, Mr. Jones.
Yes, that's me.
Hello, I'm Dr. Sweeney. Let me just do my hat. I'm Dr. Turner's resident, the attending who's looking after you. I thought I'd just come by and see how you were. I'm afraid we haven't met.
This is my lovely wife, Karen.
Hello, Karen. My name's Dr. Sweeney. I'm the resident.
It's really nice to meet you.
Before we talk about your care plan, would you like me to do that now, or would you like me to come back and do that more privately?
Well, it's fine if she's here.
Good. Can I pull up a seat?
Well, please.
Have a chat? Now, Mr. Jones, you were in a major accident yesterday. It's good to see you doing so well, but the first thing I should ask you is about how you're feeling. How are you feeling today?
Pretty beat up.
Yeah, I mean, that's not surprising given what has happened. And it's really important that we do our best to take care of your pain. If I gave you a scale to rate your pain on, where 0 was no pain at all and 10 was the worst possible pain, how would you rate that just now?
About a 7.
A 7. I call that pretty severe pain. When we're finished here, I'm going to go and speak to one of the nurses and get her to come and give you some pain medicine. I'll also ask her to come back 30 minutes later and assess your pain score again. It's really important, I think, that we try and treat your pain as well as possible. It might be that we need to give you a number of medicines to get you comfortable.
That sounds good.
Okay. I'd like to just go over where we are just now and explain what we're planning and what we've done. Clearly yesterday when you had your accident, you came to hospital, we admitted you and assessed you, and we sent you for that CT scan, that three-dimensional X-ray that lets us look inside your abdomen. And at that time we saw there was some bleeding. And we thought the bleeding would stop spontaneously by itself. But overnight we've noted that your pulse rate has gone up and your blood pressure has gone down a little bit, and we had to give you some extra fluid. And the blood test that we've done this morning, the hematocrit, suggests there's been probably some more bleeding overnight. So we think the best thing to do is to get on and repeat the CT scan just to see if there's been any further bleeding. Now that's a lot of information I've gone over quite quickly, what we're planning to do. Was that reasonably clear to you? Would you like to ask me some further questions?
Could there be any other organs injured?
Yeah, that's always a possibility when you've had an injury to your abdomen. But the things we're particularly concerned about is any injury to the bowel or the kidneys. Yesterday's scan showed no evidence of that. But that's something that we'll look at again today when we get the CT scan done. Our plan just now, it's 8:30 just now, is to try and get it fixed for around 10 o'clock. How does that suit you?
I'm not doing anything else. Fine.
And I guess it's always good to get these things done, the sooner the better. In terms of preparing yourself for that, what I'd like you to do now is not have anything further to eat or drink. There's a chance, depending what the scan shows, there's a very small chance that we might need to think about performing some surgery to remove the spleen. We'd like to try and avoid that if possible, but to help the scan be as good as possible and also to prepare yourself just in case there's any surgery. Very important for you not to have anything to eat or drink before we take you for the CT scan.
Does it include water?
Yeah, that includes water, but we know that hospitals make you feel very dry. We'll let you have some ice chips, just to moisten your mouth, just a small amount of the ice chips. Does that help you?
Yes.
Is there anything else you'd like to ask me?
Would it be better just to take the spleen out?
Yeah, that's a really good question. Generally, we like to try and avoid taking the spleen out, and that's because the spleen plays an important role in your body in terms of fighting infection. Sometimes, what we're doing the scan for today is to see if there's any further evidence of bleeding. If we think the bleeding won't stop by itself, it might be necessary for us to take the spleen out. But then that means we have to give you some extra vaccinations, and it also means that you would need to take some antibiotics every day for the rest of your life. So we try and be as conservative as we possibly can be. I'm sure you'd like to avoid that if that was possible. Yeah. Now, the CT scan's scheduled for 10 o'clock, and the orderlies will come and take you down there. Anything else you'd like me to answer in terms of the CT scan?
Can I go with him to the CT scan?
You can certainly go with him to the CT scan, but you can't go into the CT scan. And that's because the CT scan involves X-rays. You'd have to stay outside. But CT scans these days are very quick. It would only take 10 minutes or so. And Mr. Jones, although you'd be alone in the room, the technicians who are operating the scan machinery will be able to hear you. There's a microphone in the room where that big machine is. If you've got any discomfort or any concerns, do speak up. They'll be able to hear you and be able to either answer your questions or come to your aid. So be reassured about that. So the CT scan will be done about 10 o'clock. It takes a little bit of time for the radiologist to do the detailed look at the scan, and they'll contact me as soon as that's done. And I'll aim to come back and tell you the result of that. If for any reason I haven't appeared by 12 o'clock, could you please page or buzz the nurse using the bedside buzzer? When she comes, tell her that I've said I'm going to come and see her and ask her to page me. It might be that some other things have arisen in my work, but that business of paging me will help remind me of the importance to come and tell you and explain the result of the scan to you and what that means in terms of how we're going to manage your further care.
Sounds good.
Good. Well, that's our plan for the care later in the day. It's been great to meet you, both of you, and explain the care to you. So I look forward to seeing you later on and telling you what the result of the scan is.
Thank you, Dr. Sweeney.
Bye.